Hi guys, my name is Beneath. I'm a pre-med student in the Guaranteed Admissions Program for Medicine, BSMD at Virginia Commonwealth University. Today I will be going over how to find clinical opportunities during the COVID-19 pandemic. As you already know, most traditional hospital volunteering has been canceled. And clinical experience is important when it comes to BSMD programs and even applying to medical school. And so even though some medical schools may be lenient on clinical experience because it's a pandemic, there will always be another applicant that has gotten hours during this time. So it seems that we have to think outside the box, and here are some ideas that I've compiled for you. Number one on our list is your EMT, phlebotomist, medical assistant, and CNA, which are all certifications that allow you to work in hospitals, rehab centers, clinics, and emergency medical services, EMS. A cool thing about these is that you work for pay. You can also volunteer. And on a note to all your high school students, usually high school students are only able to get an EMT certification because they don't have a high school diploma. And a lot of the times, because they're under 18, they have to volunteer. They can't get paid. On that note, getting a certification is expensive and time intensive, often costing $1,000 or more, depending on where you live, and taking many months to complete. But a lot of groups like fire squads can cover the cost of your course if you agree to volunteer for a certain period of time. Regardless, you should look up these opportunities online if you have a certification or if you're planning on getting one soon. Next on our list is hospice volunteering, which is basically providing companionship, comfort, and care to elderly end-of-life patients. Now, I wish I did this in high school because there's so many opportunities available, even now during the pandemic. You just have to do your research. Volunteermatch.org is a good place to start. But make sure that it's direct patient interaction and that it's not just an administrative role, because clinical experience is dealing directly with patients. If you can smell the patient, then you're doing clinical experience. The third opportunity on our list is being a COVID-19 health screener, where you basically perform basic clinical skills like taking temperatures and asking basic questions to determine COVID-19 health risk. You can participate as a health screener at hospitals, university student health centers, and free clinics. I would actually recommend that you look into opportunities, health screener or otherwise, at university student health centers and especially low income or free clinics, because they're often understaffed and are needing people to help them out. Fourth on our list is being a volunteer COVID-19 vaccine administrator. There's a big need for volunteers to help in distributing vaccines around the United States right now, as you may know, and some opportunities may or may not be open to students, but it's worth a try. A starting point is to Google your state and health department vaccine volunteer to find opportunities. Fifth on our list is scribing. Now, with scribing, scribes are paid to document physician-dictated patient history at hospitals or clinics, like physicals, procedures, lab results, and family social history. And what's cool about this is that you can do it virtually as a telehealth remote scribe. But what's not cool about this sometimes is that this opportunity can be very overwhelming and stressful, because a lot of the times you're not given enough training and you can be expected to know everything without allowing for the time and feedback to adequately learn. Now, I've never been a scribe, but this is the opinion that I usually come across when speaking to classmates and friends who have been scribes before. But it can also be very valuable if you get past the initial roadblocks and keep pushing through and persevering, because of the amount of medical related terminology you learn in the long run. So yeah, guys, thank you for listening in on my first video on this channel. I hope you learned something today, and please like, comment, and subscribe for more content. Beneath out.